Hi, this is Dr. Ron Hickenbottom, and I'm the Medical Director for the Broadcast Ministers Alliance Health Awareness Program. Today we are continuing our series on women's health, cervical cancer. So let's talk about cervical cancer signs and symptoms. Early signs and symptoms, sometimes none, but the most common type is abnormal vaginal bleeding or abnormal vaginal discharge. Now, what is the best test we can do to detect early cervical cancer? The pap smear and the pelvic exam. Now, the million-dollar question, when should I get my first pap smear? The answer is no later than age 21 or 3 years after becoming sexually active. So that means if you start at age 15, you need to have your first pap at age 18. Now, there are different types of pap smears. We have a regular type of pap where we use the slide. We have a thin or a liquid pap. And we have a thin prep pap with the HPV virus, which is generally for women 30 years and older. When should a pap smear be performed? The ideal time is 10 to 20 days after the first day of your last menstrual period. Now, you should avoid having a pap when you're on your menstrual cycle, when you've used within the last 48 hours vaginal gels, foams, or had sexual intercourse. Does an abnormal pap mean you have cervical cancer? By no means, no. Sometimes it just simply means a low-grade infection, which we can treat with antibiotics, or low hormonal levels, which again can be treated with medication. All abnormal paps should first be repeated before any additional testing is done. Sometimes additional testing that needs to be done is a colposcopy, a LEEP, or a laser therapy. Cervical cancer treatment. Number one treatment is prevention, preventing those precancerous cells from becoming cancerous. We can do other procedures such as a cone biopsy, cryosurgery, which is freezing, laser, and LEEP procedures. Cervical cancer treatment. Again, we use surgery, sometimes radiation, sometimes chemotherapy. The key to remember is that women in their 20s and 30s, they tend to develop precancerous changes. Women in their 50s tend to develop cervical cancer. So our take-home points are that prevention and early detection lead to cures for cervical cancer. All of you need routine pap smears done on a regular basis and pelvic exams. The HPV vaccine is available for those women who need it. Thank you.